Okay, we're going to go ahead and get started, let you know that it will be recorded. So, if anybody has a problem with that, of course you can, I guess, leave, I don't know. But anyway, first of all, good evening. Thank you so much for coming. This has been a very taxing day for us. We got here early and there were no lights. So we stayed here and I went up the street and kind of begged the LG&E to put us first on the list. And they said they would do it at 3:30 and at 2:30 the lights came on. So is that wonderful or what? That's a great thing. Welcome to the Rubbertown Air Toxic and Health Assessment Community Air and Health Survey. Let me start off with that. You have a survey in front of you. We would like for you to take that survey. There's a QR code on there. You don't have to write it out. You can access the QR code and take the survey. In fact, we'd rather you do that. It's much easier for us. But if you don't want to, that's fine. If you take it, then someone will input the information for us. Did I pick up the wrong stuff? I think I did. Also, you have a card in front of you that says join the RATHA distribution list. If you want to get on that distribution list, please put your name and information and we'll make sure that you have that. The other thing that you have is that we will be having an environmental justice conference October the 19th at University of Louisville and the University Club. It will be from 9 to 3, so just mark your calendar. And this is an opportunity for you to go online and sign up for that too, also. Don't let me forget the Earth Walk. It will be in Shining Park, October the 26th. You can register and get more information at LouisvilleEarthWalk.org. This is an opportunity for you to meet several environmental groups, get together, take a walk around the park. There will be prizes and whatever else that we can come up with to give to you. The information tonight will be shared by different organizations that have come together for this particular grant. This is a 3-year grant, and it is to do a health assessment, hopefully that will lead to helping doctors, medical folks include environmental health in assessing your clinical diagnosis. So with this, I'm going to just call the names of the organizations. I'm going to ask you to come right up and speak on your behalf. I know I've left something out. Why? Like I always do. What I need is laying over there on that table. Okay? Okay. So with that, we'll have APCD, Air Pollution Control District, the Environmental Institute, University of Louisville, the Louisville Health Department, the West Jefferson County Community Task Force. We are the ones that will be doing all the public outreach. And did I leave someone off? I know I did. Park the Ball. Park the Ball. Park the Ball will be working with us. They're specialists. So with that, I'm going to turn it over to Air Pollution Control District. Thank you. Oh, let's see.
I think I can drive, but I appreciate that backup. If you wouldn't mind, just in case it doesn't. Good evening, everyone. Thank you all so much for coming out tonight. I am Rachel Hamilton. I'm the director of the Louisville Metro Air Pollution Control District. And I'm going to call out a few folks. And if I need to, I'm going to phone a friend here. That would be my colleague, Matt Keith, who is APCD's Industrial Permitting Manager, and our former colleagues, now Director of Parks and Recreation, so is our Assistant Director, and also, all right, better. All All right, now that we've moved up closer, Byron Neary, our former regulatory coordinator, now with the Kentucky Resources Council. So the Rubbertown Air Toxics and Health Assessment, or as we call it, the RATHA, is a project to examine and address health impacts of toxic air pollution as well. With a focus on the neighborhoods around the Rubbertown industrial area. During the project, the partners here on the study air pollution in West Louisville using air monitoring and wastewater sampling. And the findings will be used to develop a risk assessment, inform policy recommendations to help reduce public exposure to toxic air pollution, and create plans that will help medical practitioners account for air pollution sources out of care. As Arnita mentioned, this is a 3-year study that just gotten started. And as we get started, sometimes it's helpful to look to the past. We'll also talk a little bit about the present and then our future work as a lease. Thank you. So Rubbertown, the area started from an industrial standpoint back in about 1918. It was home to Standard Oil refinery. With the rise of World War II, we have the raw materials here necessary to start synthetic rubber manufacturing production in the United States. In particular, ethanol, which was refined into 1,3-butadiene, which is one of the components of synthetic rubber, as well as chloroprene, which was made from sunny and carbon. And I think
And for those, I have to get that.
I did instead of rubber, that's
We'll get back. We're having a little technical difficulty here. We don't know, like, we're going there.
Somehow cats shows up abundance.
Now go down to the bottom. Here it says
Right there, share that window. Then you have to click share again. It's a whole multi-step process.
All right, much good.
This one works.
Ian, are we good now? Can everyone hear me now? All right. You go back to slide. Couple more. All the way to the beginning. There we go. Okay, let's start this over. So we are here to talk about a forerunner for where we're at tonight. And we're going to go back and do a little bit of history. So Rubbertown began industrial operation around 1918 with the start of the Standard Oil refinery in World War II. We saw the development of the Rubbertown synthetic rubber manufacturing complex. Because we have the raw materials here in Louisville, as well as a good location, inland, and good transportation. Next slide, please. Today, Rubbertown is a complex that includes about 12 Title V companies. Those are the major sources that we deal with through the Clean Air Act. But it's also home to a rider community. So this is not only an industrial port, but it is a residential area as well. Next slide.
What we focus on in ABC are air toxics. Those air toxics are under the Clean Air Act and hazardous air pollutants. We also call them toxic air contaminants, but they've been identified as having potential to cause cancer or other health impacts. They come from a variety of sources, point sources like those stationary plants that are located in. You may also think about completely gas stations or dry cleaners. They also come from local sources as well as natural sources. Last summer, we submitted impact from the Canadian wildfires, the volcanoes, and the biology formation trees there as well. And then roots. We're going to delve a little bit into this timeline tonight. What you see here is the result of community impact. Community here in Louisville is concerned about the emissions coming from those stationary sources, those point sources in Rubbertown. As a result, they formed that West Jefferson County Community Task Force and other groups react. And others began to push for an understanding of what was in the air. With the West Jefferson County Community Task Force as a lead, University of Louisville, ACP, and UVA, they undertook the first West Louisville air toxics study, 2000 to 2005. That information formed the basis of the political will necessary for the district to develop its strategic toxic air reduction program, which was adopted in 2005. Since then, my colleagues have been implementing that program in the district. Next slide, please. West Global Air Toxics Study was a one-year study. It was conducted by the community, and it monitored 83 volatile organic compounds, 63 semi-volatile organic compounds, hydrogen chloride and hydrogen fluoride, as well as key metals. Out of it, a great deal of information, but it did identify 17 of those hazardous air pollutants as having a risk greater than one. Next slide, please. While that study was going on for several years thereafter, there was a lot of community involvement. District itself, about 60 public meetings to talk about what the findings were, what the next steps should be. That was to help build consensus in terms of that regulatory program, but also for the study itself. What were we going to look for? Where were we going to look? And then what would we do with it when we were done? Next slide. The STAR program is a result of that. STAR is a regulatory program. It's focused on air toxics and goes beyond the federal program. One unique feature about the district is, first and foremost, we are a creature of the state. The General Assembly authorized us in 1952. Since then, they've allowed us to be more stringent than state or federal law. The STAR is not propping them. It provides a framework regulatory action. It does require companies to assess and address their emissions of air toxics. That requires us to manage those sources. We don't do this program by ourselves. We're one of the state and local programs that have the air toxics program that is stronger than the federal air toxics program. But we rely on a vast array of scientific professionals to tell us the science. Toxicologists and others set the benchmark ambient concentrations for us. That helps us understand the risk of the chemical is. And that's a little bit different about how we sometimes talk about the other stepping in. Everyone's familiar with those in particular matter. And oftentimes when we're working with them on the regulatory effort, we talk about reducing them in mass. We'll reduce X tons of particulate matter into this project. Risk is different. Here we're really looking at how much of a chemical may cause. Sometimes that may be more than another chemical. And just evaluating and kind of ranked in terms of their risks. Our permitting process, for the most part, for our large sources, we use an air dispersion model that estimates the exposure to the maximum concentration that a plant could emit for 70 years exposure, 365 days per year, 24 hours of that day. So it's very conservative. Once we have an understanding of their emissions, we set a permit limit that they have to comply with. And anytime we have a permit that we develop, we also develop the record keeping, reporting, and monitoring necessary for security. Okay. So when the district developed the STAR program, they broke the 188 hazardous air pollutants and a handful of additional pollutants that are specific to rural in certain categories. And that was to help manage that growth line. Category 1 tags are the 17 chemicals that concern the Western neurotoxic study. Category 2 tags are those at a RACE score of 500. That's an EPA screening level that allowed us to say they seem to be more risky than others. Category 3 tags, what remain of the category tags, those are the remaining hazardous air pollutants. We call those the dirty 30, because they are more likely to be found in an urban environment. And then last, category 4 tags are all used to the lives of thousands of people. Next. What sources of regulation? The Title V companies are regulating their spot. Right now, we have about 36, 32, about 32 Title V companies. And then we have a smaller set of federally enforceable district origin operating permits that might be as large as the 25 companies that actually take it and put it to remain small. And there are about 90 of those. And then lastly, the STAR program does figure in the future. And that even if it's isn't in one of those two categories, the general laws may allow us to bring in any source, and it will also allow us to bring in any other that is already listed. Next slide, please. Finally, this is very important. I'm going to ask for everyone. Give them a question. STAR is a what? STAR is a do, not did. We've had opportunity to talk to some other states that they've been stating that they're going to programs. It's been surprising because the number of those programs is led to a one-time analysis and a one-time demonstration. Here in Mayville, you have to show the clients at the beginning for an existing source. Anytime you come in for a modification or a new project in your facility, anytime you have an existing mission, and anytime you're a property. We also will on site investigations. Companies are required to submit information to it for at least semi-annually. And then, of course, we're looking at the data that we receive from autonomous and evaluating that against the sources and issues as well. This is one way to take a look at the current state of STAR. Back in 2000, for the category 1 toxic air contaminants, multiple ratings for 11 in the nation in terms of how much of those contaminants were emitted. 2 years later, EPA came with a relative risk screening evaluation And out of the 8 southeast states, they ranked Jefferson County as having the highest emissions. Here on the slide where it says 2021, you'll see that all of us have made reductions in pollution. However, we've moved from 11 to 162nd place out of the world times. So it's good progress. Next slide. Another way to again is this gas. You'll see here in the gray, those are non-fuel plant emissions. The yellow is electric generating utilities, and the blue is chemical manufacturing. All of those sectors have had reductions. Not all those are historic, those are due to government programs as well. But the good news is we're that shows up in the monitors. So it's good progress because we're trying to continue to see. So the category 1 temperature looks like we're in the middle. You'll see here big drop off. And 2006 to 2009 time frame. That's when companies were required to put on controls and to reformulate to reduce their emissions. Next slide. And that brings us to today. So we've seen the problems. We've seen the emissions inventories as they are being submitted. We also see the data that we have at our floodway station. But redoing the WLNTS, or the West Field Air Toxic Study today, almost 20 years after we started this past, has been a goal for the district, so that we can have an apples to apples comparison to see how some risk being reduced as much as we anticipated was being. And are there things that we need to look out for next? So for us, we will be conducting the West Global Air Toxic Study method. There will be canisters that were placed throughout the community. They'll take a sample once every 12 days, 24 hours, and that study will last a year. We're also going to be getting that also from out, and we'll talk about where. Second, the location of these canisters have been chosen because they are representative of the previous 7. We're trying to do this as outpost to outpost as we can. They'll also take into account current emissions estimates, because we know that many of those companies that used to emit a lot are emitting fewer. But we're still very interested in those that are maybe with risks. We also need to be sure that the sites are meeting the quality assurance and federal requirements so that we have good defensible data that's valid for us to test. So they're actually going to be 7 monitoring sites. But there were 2 located on the facility. One Parkway, which was the site of Mexico, impact and West Toxic Study. There'll be 2 canisters placed, one will serve as our quality control. It is standard from Rubbertown. If you're familiar with fire restraining site, front page, there's a little trailer kind of near the river. So a bunch of things going off on top of it. That's our control station there. There'll be 3 other sites where we'll be measuring volatile organic compounds. I'll show you some pictures of where those are located. We'll have a background filter of Cannon's Lane, 2 levels of monitors that's what we set up. And then we'll also have mobile formaldehyde launch. It's a little bit hard to see here, but okay, so we're going to have sites in around this area. We've got our outward monitoring site here, additional sites here, and our Cannon's Lane site over there. I can see that where the 3 gifts seconds. So we're gonna have VOCs that are gonna be in Rubbertown. Sorry, but in Rubbertown. We'll have an album, maybe. Near Round Avenue, the campground building, and near Chickasaw. Near Chickasaw. We'll also have some metal monitoring in St. Stephen's Baptist Church. Then we had another metal monitoring, which will probably be co-located in one of the walls for the sites. And then the mobile formaldehyde monitoring.
The ones that VOC, but VOCs, are they measurable same VOC that they or?
Yes, yes, absolutely. I think that's it for me. Any other questions for me? Yes.
So much
Yeah, I'll take that one. And I will be presenting in a moment anyway, where we will be addressing that exact concern. Our project will not have a food cohort study. What we are doing, and which I'll explain in the presentation, but we're going to be using EPA standard and ATSDR developed risk assessment methods to look at both the cumulative exposures, which I think Lauren is going to be talking about in our sewer monitoring, as well as what we're seeing in the air and be calculating risks for cancer and other VOC-related health effects. But hopefully that will be a catalyst for a further prospective or even retrospective cohorts.
With regard to this follow-up study, the first study did a very good job of having to see all the results of the market and almost in real time. On a database of lists. It wasn't some kind of big organization and saying, this research, that you don't see the research for 2 years, we have to try to see it and we quality on it. Will we have says to the aeronautics we have, how frequently we have that so we can advocate for ourselves. And know which monitors are showing the maximum of these VOCs. So the monitor data will be made available for the rest of the task force using the website. We will be specifically cloud data analysis. So we'll put that data is about to the lab. They're really going to have that turnaround time. It tends to make that data available as.
So are you, sorry, was there a QA process after the lab or the lab already had that say this thing that you guys believe it's putting right on the list?
So the lab reports will be, the lab will be that quality assurance quality control. But in terms of how long it will take to do that work, and have to send those for student.
We've done that before.
What I hope to. Any other questions? And along with that, task force. And all the patients should be operating. So we have pardon?
Will the 12 days are going to be a city by the way? And will the 12 days are going to be a city for recycling and monitoring Space or would they staggered also on sites?
My recollection was that it was staggered before. It was every 12-day, same day. Was trying to capture that flaw in the view. So,
Assuming that data is explained public, some of it already in the same way. Seems like a lead. Exactly what they are, so possible for public or swaying. Even it says something where we've been in this graphic ways.
well, it makes sense what I'm trying to.
I don't. So it's a possibility there.
So certain things in places that they can be, secure. See what something full, but trying to think about prove the house.
First, different ways for some.
Yeah.
Yeah, it would make them part of the duties.
This is this difference. How would you compare? Is this different? It's probably.
Yes, they're connected. But one thing about this study is that it will help us understand what student might not be expert. Because those things that we can't smell still make it our choices as well. And so we really want to get a better idea of whole airship. But I do want to encourage folks, so I know everyone's seen the report. The reports that we make about voters are tremendously helpful to us. And so please continue to do so. We can call us or email us. We can use the Sloan Up City account, but use to my email inbox as well as I see what folks are experiencing and it's really incredibly helpful information to us. So please encourage everyone to continue reporting.
So the Spanish shows that search around specific things that are.
Yes. It is not. It is a good question. It's a different, people to learn. Fire answers, whether or not hydrogen is sulfide and knowledge was part of the study. It's a different type of individual, so the knowledge we want to bring forward as part of the first group. This is knowledge to bring forward how to work from the you explain more about the global monitoring. It's a mobile monitoring program now. Once it different type of equipment from the fall toward the enhanced students. The problem, like, not so. Not really sure how yes, but right. So there are. EPA has a really nice plan of how we're doing that, and it is loaded up with different types.
Yeah.
So there are mobile monitoring units, we have a array of types of monitoring equipment on them. This is a single monitor that can be moved and programmed or slated and then put in belts. The type of monitoring you do stationary, it's in a shelter, the shelter comes from property sited. This one is a lot of exciting conditions for fighting this specific. Billy DeWitt, our manager, we had never about this specific, last week, and I'm trying to do my best to understand him. It is a laser that's looking at fluorescence of formaldehyde in the environment. One of the reasons that we're interested in formaldehyde, first, we have the formaldehyde source here. But equally as important, there are non-reduced air chemicals in the middle. We have things in trees, which then undergo the transformation in the environment and they form formaldehyde as secondary pollutant. So we're interested in understanding both from a risk standpoint. But we're also interested in looking at it from an ozone formation standpoint. That's another problem issue with me.
Do you have a breakdown like this one, these blue? Like,
I don't, at this point, communities equipment for us is fairly new to use. And so we're bringing in, and we can introduce development communities for it. And then we'll use it. That we want to look at that source here at home. And we'll try to get a little bit broader picture of there's any other questions? Yeah.
Greetings, I'm so happy that you all are doing this event. My name is Dr. Angela Jackson Brown. I'm the founder of the Global Investment in Education. We in Jeffersonville, Indiana, have also experienced environmental hazards as well as fallout from the industries around, including contamination of the air and the water bodies. My personal view is that they environmental conservation with the agriculture aspect and deal with lower context. There is fog that happens. We're only by the bridge of the mountain or close to the line of the river over in Indiana. My question is, have you had any kind of collaboration, partnership, on what a fallout is? Because we know that earth carries seeds and examining cross-pollinate farmers next door up to even 50 miles. So where it affects. So my question to you is that something you're aware of, and can you collaborate with us across the river? Because we too have to find millions of dollars like EPA and push.
That is a great question. That actually is something unique about where we're here
Yeah.
in Louisville. So our metropolitan statistical area focuses the Clean Air Act, include Clark and Floyd County, as well as Bullitt and Bolton counties. So that means when we have issues, we have to sit at the table with our counterparts from the Second Division for Air Quality and also partners of the Indiana Department of Environmental Management. So we're all coming together because we impact just. We also work collaboratively with our own Region 4, that's EPA in Atlanta, as well as with Region 5, where I'm going to locate there in Chicago. So it gives us a lot of environmental professionals looking at things together. The Indiana Department of Environmental Management does their toxic monitoring at the falls of the other line.
Yeah.
Our predominant wind direction towards that area. So we are all looking at the same air quality we see in their shed. I will say that Biden does not have its own air toxics program. And so there is in the federal program. It's programs rather unique in that we're looking to control risk from a single toxic air contaminant. From a single process of a company in one minute. If the company was existing in 2005, all of their emissions have, in other words, less than 7.5 million. And as they build new, or they build 7.5 cumulative total drops to be. USDA has their own risk level that if it's under 100 million, it's acceptable. So we're looking at a very different level.
So you have higher standards.
So we have lower, right, higher standards, and lower goal that they have to meet. And that is something that our colleagues and our compliance group work on every day.
Well, I thank Cindy for doing, Aretha for doing the work she does with the STAR program. So I do commend her for helping along with her colleagues.
Follow-up question that, so we were talking about 1 million. You talked about 1 million and 7.5 million. Did that, those, are startup shut down malfunctions included in that? Okay. The future emissions as well. So, thank you for that. Matt?
Like you say, those are harder to estimate, those are harder to estimate in staff emissions. They are legally included. It's easy.
But that raises a really good point, Mrs. Ratchet, that, so there are a lot of productions that we'll see on the electric generating utility side of the project, their cost is more. They are going to shut down in 2021, in 2024, unit 2, in 2027. American Synthetic Rubber Company is converting from coal to natural gas. Those will reduce those coal-based air toxins, and that's great. But also in the next 18 months, I believe, we will begin to see fence line monitoring for sources of mercury, butadiene and vinyl chloride. Here in Louisville, there are 5 other contaminants not admitted here. But that's going to be a really good way for us to see those emissions that are going to estimate the emissions as opposed to a sky emission. Really trying to think of it. So,
I have a similar cross-contamination question. For this study, how are you guys accounting for the background noise, say like car traffic, fire pits, forest fires, that, okay, I just want to not know for forest fires, because it's just, please, no. We have a background site at Cannon's Landing. So that's an urban background site. It's just right in the kind of the end of the field. And so we'll use that to have that comparative transportation and other sorts of general background things.
Any more questions? This is just first stage before we're really prepared. So it's very important that we get this information, when we do it the way it's supposed to be done, and get it out for everyone to look at it, comment on it. We want to continue the comments, continue the discussion as we go along. We've got 3 years, I might get tired, but I'm not going to do this in the next 2 years, okay? So,
I'm sorry, when did monitoring start? What, do you know when the monitoring started?
So we have completed site selection. The license required and the contract with the labs, and we are processing hiring for the student. So that's been a bit more protracted than we had hoped. I do have another question in the chart.
First one is what the name, and the second one is that is also the first one. Where vehicles allowed to regain they actually use sunflowers to help absorb the toxins in the air. They're both bad because they're buzzers, kill. So they look at the holistic side, what can we do for those.
That's a wonderful one. Thank you.
With respect to what's next,
At the end of the study, what we hope will come out to us, regulatory agencies, and our partners in local metro government, our recommendations, whether that's for the STAR program, or perhaps even rezoning. What we do know here in Lowell in particular, we have a lot of fence line communities today. We need to avoid future fence line communities, and where we can create dispersion, create buffers between plants and people. I think that's a good practice too. Trees, we know we have an island issue here in Louisville, and as trees are planted, I think it's going to be one of the things that we're looking at. Is how do we use those to improve health? The Environment Institute through the Green Parks Project has done outstanding work showing that they have some public health benefit. And if there's a way to use the study to really find that from home, that would be a fabulous outcome.
Okay, sounds good. I'm going to plan. Okay. Any more questions? One more question.
All right. Oh, my God. Share this one. It's nice. Oh, sorry, don't mean to be sharing your mail up there. Well, oh, you know what we need to do, Rachel? We need to download it, I think, already.
Do you know how? I'll introduce myself.
Figuring out. Hold on, I'll just go ahead and introduce myself. Some of you I know, some of you I don't. My name is Fred O'Connell. I am a gynecologist and I'm currently almost finished with my PhD at U of L. I say kind of jokingly. And I'm getting my PhD in public health epidemiology. And on this project, I am the research assistant at the Brown Environmental Institute. So I am working closely with Lauren as well as Marnita, who's hiding over there, and all of our partners on this project. And my baby on this project is the health risk assessment, which is one of the major cornerstones of the project. And I'm just going to keep talking for a second about it. But since I actually don't touch on it much in the presentation, so I'll just go ahead and talk to you a little bit about the health risk assessment. So it is a 2-year risk assessment, the first this year, which hopefully it will be able to be shared the next couple of months. I think I'm about 90% finished. I am using historical data from the WLAS, the global air toxics studies. Nice. And as well as other data like the EPA air tox screen and Tuesday screen data, which you know has a few issues to calculate some risks, cancer and other VOC related. So we'll go ahead and start my little presentation. I know Rachel did a great job talking about the WLAC study. So I'll just briefly touch on those, like Rachel said, between April 2000 and December 2005. There were 2 West Rural air toxic studies conducted. And the same partnership working on this project worked on that. So we've got our West Jefferson Community Task Force, the APCD, U of L, under this EPA grant. And the purpose of those studies was to determine whether residents of the area were being exposed to airborne concentration. That's fine. You can stay there. It's good. Airborne concentrations of harmful air toxics. So there were 12 monitoring sites in that first study. So this is just a brief overview of those sites. Cancer risk from exposure to those VOCs was calculated at each site. And then other chemicals and metals were also evaluated. So not moving forward in line. I know I'm.
Go. This window. Oh, but why isn't it?
See?
What in the world? It should be. Share that window. Share this window.
The change?
We'll get it. My school plans, but we're not at WebEx meetings apparently.
So
And Rachel, will be the next slide. Okay, so this is just a small map of those first sites. You can see that they are all concentrated in the Rubbertown, the red one?
The pointer.
There we go. In the Rubbertown area, as well as this Cannons Lane site over here. Okay, so chemicals of potential concern were identified at each site. To be considered a chemical of potential concern, the chemical had to be detected in at least 10% of the samples collected from that monitor. And then only those substances that were known or suspected human carcinogens at the time in 2005 were considered in calculating cancer risks. And they looked at volatile organic chemicals, VOCs, as well as other chemicals and metals. So VOCs are connected to a variety of health effects, particularly cancer, as well as damage to the liver, kidneys, heart, and the central nervous system. The results from the WLAS-1 did show that all monitors had VOC exposure levels that exceeded the Kentucky state threshold of 1 in 11 cases. Oh, I can do it. I think. This is the EPA's method for determining if a chemical is potential harm. And it's kind of hard to see, but the threshold that Kentucky uses is actually lower than the EPA. So we think it's a problem if we're seeing one case in a million people in excess. And I think theirs is a little higher.
Just real quick.
Yeah.
Is that Kentucky or?
It is Kentucky state threshold, but, so the WLAT studies, use the Kentucky state threshold of 1 case per million. So these are some of the COPCs that were detected from the WLAS-1. We saw vinyl chloride, 1,3-butadiene, acrylonitrile, methylene chloride, chloroform, benzene, carbon tetrachloride, trichloromethane, tetrachloromethane, 1,4-dichlorobenzene, ethyl-acrylate, and bromoform. Those were some of the ones that were detected at levels signing them to cause cancer risk, as calculated in the WLAS. These are, oh, that's strangely not showing up, but these are the cancer risks that were calculated in WLAS. The blue, which is showing up, is that was sort of from the median or the middle levels that were detected, and then these higher ones were from the maximum levels that were detected. So they range from, and this site 2B, which has the highest, is there on Ralph Avenue. So that's the Ralph Avenue site right there, 2A and 2B. And then 1 is Algonquin Parkway. Where's Jefferson? Chickasaw. I can go right back and tell you. Oh, how I'm doing it. So the Chickasaw Park is site 9. So that would be this one right here. So compared to Ralph Avenue, a little bit lower, but still high enough to cause concern. The WLAS-2, similar to the WLAS-1, used 6 sites that were a subset of those first 12. And that those are here. And again, Cannons Lane. And this is just the correspondence of the study 1 and study 2 sites, so they were almost identical, except that WLAS-2 only has. And again, here are the cancer risks that were detected on those sites. And just to compare side by side, this is WLAS-1 and this is WLAS-2. And so these are Ralph Avenue, this is Ralph Avenue, and then this is Algonquin 1 and 8. So again, they identified chemicals of potential concern. Similar, there were a couple other ones, as well, in particular chloroform and naphthalene. So just a brief, I'm not going to read you every single thing that's on the slide, I promise. But vinyl chloride has been associated with Chronic exposure to vinyl chloride has been associated with liver damage. Liver cancer, in particular, a rare liver cancer called hepatic angiosarcoma, as well as lymphoma and leukemia.
And just to connect that to the community, when we looked at the database before and during the survey, vinyl chloride showed up a lot, which you saw parking on. So that's just to show you what people in the area are being exposed to.
Yes, ma'am, and we'll talk a little bit about that as well. So again, we've got the 1,3-butadiene, which is associated with cardiovascular disease, which is the #1 cause of death in Jefferson County. Well, in the United States, but also in Jefferson County. Acrylonitrile is associated with lung cancer. Benzene is associated with anemia as well as developmental damage, and a multitude of cancers. We've got methylbutyl ether, or MTBE, causes central nervous system damage. Chloroform can cause hepatitis as well as other liver and kidney damage, including cancer. Naphthalene, again, liver and kidney damage, anemia, and neurological damage. Carbon tetrachloride is a possible human carcinogen and is associated with kidney and liver cancer as well as acute myeloid leukemia. Chronic exposures to tetrachloroethylene, again, tetrachloroethylene is a group 2A carcinogen, linked with non-Hodgkin's lymphoma and multiple myeloma. Same with 1,4-dichlorobenzene, excuse me, sometimes I can say them, or get them right. Can cause respiratory damage as well as liver and kidney damage. Ethyl acrylate is associated with colorectal and stomach cancers, which is a whole lot of benefits. But like Rachel said, since the implementation of STAR, we have seen emissions go down drastically from the Rubbertown industrial complex. Here are some of the changes. The additions of controls at American Synthetic Rubber resulted in reductions of 1,3-butadiene. Naphthalene, acrylene, bromoform, tetrachloroethylene, chloroform, tricarbamazine, and vinyl chloride. Vinyl chloride in particular decreased from 2.29 tons in 2000 to less than half a ton. So there have been a lot of changes since STAR. So thank you, agencies. These are the yearly mean concentrations of some of the monitored chemicals from the Algonquin Parkway site. And I'm sorry, that's going on now. So we've got vinyl chloride, benzene, and 1,3-butadiene. This is prior to STAR. And then here is the most recent we had in 2023. So significant reductions in monitored chemicals. However, and thank you so much for paying attention to that, we do see high rates of cancer in Jefferson County. This is showing the disparities, and we are well aware of the disparities between white and Black people in Jefferson County as far as cancer health outcomes. So on the left here, here's our little Jefferson County right here. So we see lower rates among white people in Jefferson County than we do in Black people in Jefferson County. Yes, ma'am. So I can walk up close to the screen. So for if it is red, it's a rate of 546.8 to 619, and that's per 100,000 people. So those are age standardized cancer rates. And again, I just want to give a caveat before I start talking about this too much. These are just the age standardized rates as reported to the Kentucky Cancer Registry. I haven't done any risk analysis with this data yet. This is just showing the rates of cancer that we're seeing in Jefferson. And then orange, so what we're seeing on this left side for white people is 509 to 524.2. So the rates are a little bit lower. I'm just trying to put the math in my head right in front of you all. Okay, so this graph right here is just showing the cancer incidence rates for all sites of cancer between 2000 and 2021, which is the most recent year we have data. And the orange line is rates for Black folks and the blue line is the rates for white folks. So we see a pretty constant disparity in those cancer rates. And I'm just going to go through these very briefly. They're just all the same. Orange is Black people, blue is white folks, and the green is the changes in cancer rates over time. So since the WS one in 2000 all the way to 2021. So this is lung cancer, where we're seeing significant reductions in due to the smoking ban. So thank goodness for that. Liver cancer rates are much higher in Black people. This is Russia.
So this is not just.
No, this is just, yeah. Yeah. So this is liver cancer. We see a huge disparity in rates of liver cancer. Again, this is acute myeloid leukemia. We don't see as many cases, but when we do, there are more of them. Again, this is lymphoma. Stomach cancer, which what's it right there in the middle. This line, so the orange, this is the rates for Black folks in Jefferson County, and this is for whites. But now look, we're not right there in the middle of this nice. And it is hard to see on this screen because of the lighting, but there is a trend line here. So it shows that since 2000, rates have risen for almost all the cases except colorectal and lung. Again, this is kidney cancer. So this is the trend line right here. Colorectal cancer is going down, thank goodness, but there are still disparities here. You can see pretty significant disparities in cancer rates. Myeloma, pretty intense disparity there.
You are, is that what the data that sits down to location of where the Black folks are?
Yes, it is in process. So that is one of the data sets that we are working on acquiring, is getting census block level cancer rate data so that I can hopefully somebody much smarter than me can take a look at those and do some data analysis to risk assessment. This is total cardiovascular disease death. I don't know why, ignore that title, but these are cardiovascular disease deaths by race in Jefferson County, and we can see that compared to other races, Black people are dying from cardiovascular disease at higher rates as well. So that's like a lot of doom and gloom, but we are trying to do something about it. So this study, RATHA study, like Rachel said, excuse me, the ABCD will be collecting air samples to be monitoring for those aerotoxics. U of L will be doing the health risk assessment. So we are going to be looking to see if people in West Louisville are having more health problems than usual, particularly those rare forms of cancer that are associated with VOCs, as well as cardiovascular disease. Most importantly, and what Lauren is going to talk to you about next, is that we will be implementing wastewater monitoring through sewer monitoring, so that we get a better idea of actual exposure, the actual exposures people are getting at the community level, not just monitoring what's in the air, but what's actually, coming out. Yeah, what's coming out in the sewer. And then the most important part probably is our collaboration with the West Jefferson County Community Task Force and Park Duval. We will be, U of L and ABCD will be working closely with them, sharing data, developing health risk assessment tools for clinicians to be using so that they know what to look for when seeing patients and what to educate patients on so that we're about it. And then very briefly, wastewater surveillance. U of L has developed a method for monitoring VOC exposure through wastewater, and we will be implementing that at sites that will correspond to the air monitoring sites that Rachel and the APCD are overseeing, and we will be collecting samples of those weekly, is that right, Ted? Is that right, Lauren? 3 times a week. We will be collecting those 3 times a week. It's changed, it's evolved a little bit since I first made the presentation. And then our proposed area sampling sites, I think we are narrow, Lauren will talk to you more about it, but I think we've got it narrowed down. And then, so future directions, like you asked, we're gonna have census tract level data on cancers associated with exposure to VOCs, as well as data on cardiovascular disease rates by, I think this is granular, I can go with zip code, but close enough. And we're going to have data on other health impacts from VOC exposure, and I will be performing some statistical analysis and risk assessment based on that data. Both the data that we collected and health data that we get from census tract. And that's all I have for you. Does anyone have any questions for me? Yes.
In addition, so it sounds like you guys are doing some good work, but in addition to the work that you're doing, is there any component of these studies that specifically talk about possible, the impact that some of the sources of these diseases, you know, why do we have these diseases? We know that part of this is industry because they're the ones putting out the biofilm out of this and even though about can be formed out of natural babies, we know that we have like one of the patients, maybe the world's largest formaldehyde or whatever in that baseline. Is there any information that's going out that advocates the community or says, we have found this in this study, and part of the problem is industry?
I am hoping through the health risk assessment. Now, our study is designed is looking at ecological studies, so we're looking at things on the community level. So we're not making any, you know, assumptions about individual people. We can just say, hey, in this neighborhood, we're seeing these levels of cancer or CBD, and we're seeing these levels of, you know, exposure to these volatile organic chemicals.
I said, that's, I mean, I think that's fair, but I just want to make sure that the message that goes out is not a personal responsibility only.
Oh, absolutely. No, no, you can. Yeah. Oh, yeah. We will not, that will not. Oh, yes. And Rachel will touch a little bit on public health and wellnesses and role in that, but I know this project is personal responsibility is not something that we are blaming anybody's individual exposure on at all. We will all use from ambient air toxic exposure.
Three illness facts today. They just recently were fined $10.3 billion for the chemical that's put in the air because of their statute. But industry definitely. So before we move on to that, I wanted to share that to Evan's question, what's going to happen after this? They're going to become recommendations. And from that information, not only will they come to agency, but our partners in public health and wellness, Alicia here and say, toxicologist who's working with us, epidemiologist at the public health and wellness. She is unfortunately having to join and do the virtual. And so asked that we share her remarks. Global public health and wellness will actively participate in community meetings, workshops, providing crucial health equity data and sharing expert insights to help inform residents and other stakeholders about the health impacts of pollution. Utilizing the findings from the annual toxic assessment and subsequent health risk assessment, Global Metro Public Health and Wellness will contribute to the development of informed policy recommendations. These policies will aim to reduce exposure improvements and address health disparities across global. They will also incorporate the project's findings into its existing public health programs and resources. But that will be heard today is that this is a whole of agency and public health and wellness. Looking at this data as how it will inform our work going forward. So
Yeah, what I should have said as well, part of the risk assessment, data, working with global public health and wellness, using the most recent health equity report, which came out in 2024, and I encourage everyone to take a look at. which the whole emphasis of the health equity report is looking at the roots of the problem. So, what are the roots of the problem? What can we find out from our study, and what sort of policies can we promote or develop?
This is, this is what's in this, shared with us. I'm very appreciative of what your colleagues and everybody that's involved in this, level of research and bringing to people. My question is, here in this room, most of us are either the stakeholders or involved in some aspect of the more deeper level with the evidence-based research. How we disseminate that to the people that most are affected in the lack of knowledge to people. Should, but my question, that's one question. Channel down to grassroots level, educate them, and it's not people to understand, are able to interpret the data correctly. Some of the solution. Now we know this problem just from our families and good friends that some working in the class that we're responsible and it's one. It's in the plan. It was based on also class action. It's on the preference of that. My next question is you are showing the statistics data with the comparison between the East End and the West End of the level of different chronic disease. What is contributing to the East End? Some of what's going on. Are they starting to have appointments? And how do you measure this data? How do you gather this data? Western,
So for those graphs that I showed, just to clarify, it wasn't divided by census tract until we get the data from the state at the census tract in block level. All I can show you right now is rates for the entire county. So that's why I chose to show the disparity between, and that's for the whole county. So not just for West Louisville, but for all of Jefferson County, comparing rates of cancer and CDD in Black people and in white people. But the data is coming straight from the Kentucky Cancer Registry. So that's not anything that that's not anything that I've calculated. Cancer is a reportable disease. So the Kentucky Cancer Registry has that data. But but we are working on getting this data from the state so that we can paint a more accurate picture of who exactly is getting cancer and where it is. And you're welcome. I just wanted to follow up on the first question about information. Sorry, I'm so I used to work maybe now working trade near my heart's project, and there's a few other issues that we haven't touched on as much today. I think we're hearing more about the beginning further in. But West Jefferson County community supported this the community program a lot of their role information from the set out to community through meetings, but also through the website, additional print materials and community events, presence, and also at Commonwealth Community Health Center, we'll be working with they'll be working with the community health there that will everybody's directly to the clients and choose there at the Commonwealth Community Health Center so that they have more information to those practitioners when they're speaking about their health issues and about the time who's coming up with the city. So there's a couple different layers of trying to bring this information from the research level to that practical, every conversation. Yes. Thank you.
One board that we cannot forget is our state legislature. And have a bill that will provide lanes to, general plants. And, so that they have to be educated. And that's carried on, so representative in Southwest Jefferson County, where there's a lot of kids. So that needs to be a part of whatever plan. Because we've got some of these. Now,
Simply because of an fleet. Jefferson County, west side of Louisville, how does it compare with other metropolitan areas for this type of pollution? Are we an cesspool, basically? Yeah.
So-
Is that what we are? And so, there's the responsibility for creating cesspool. What does cesspool mean for that we're
That's right. And like Jeff said,
Okay.
oh, I'm gonna let Rachel take that one. 'Cause I'm the one who gets to cop out, since I'm just the grad student.
But it is a good question. But it is one of the reasons why 20 years ago, we stepped into a strategic toxic air reduction program. Because there at that time was a decision made based on data. Knowledge, our data is one of the things that was used in order to create the political will to put in one of the nation's most stringent air toxics programs. We recognize it's an intervention in time, but now that it's been in place for 20 years, we see emission reductions. We also understand from our own air toxics monitoring that there is significantly less pollution today. We want to make sure we understand what that means. So that's why this study is really important for now. When we talk about that 1 in a million level that Kentucky uses, that's a screening tool for the 119 other counties in Kentucky. It's a regulatory limit here in Louisville. So we know that it's possible to use data in a way to tell a story and to help share that information with leaders, elsewhere, and understand the story. The Center for Health Equity is an amazing health equity report. If you haven't seen it, it's a very compassionate look at a tremendous despair in very clear language and graphs. So I encourage you to take a look at that. And then to join us in this project over the next 3 years to gather data. And we need to look at potential solutions for the problems that may be here. I know I haven't answered your question, but it really is a question that we're longer than 5 minutes.
I want to say it's really good. I know we put a lot of stuff in the grant, written, but I think it's very useful to compare students that are generating their classes and maybe measure today's should what. It's understood.
So
Finalist,
we're not the only system. I'm saying those are the people.
Where do we fit in this process? It's the community, 50 years, 60 years down the road. What's left of the essentially of the people of the West End? A group of very sick and broken down people. What's left?
But this is exactly, this is, I don't have a record here. And say, where are you going? Why is I'm strong? Just what you said, just what you said. When I came into this 27 years ago, a long time, I was 10. All years ago, when I first started in this, the biggest thing that came to me were the University of Louisville
as about injustice of a person there was here in it. That is the main reason, and that was the target. So what did we do? We started with let's test it, let's find out what's going on. That's what we did. Out of that came the started because we were testing specifically what wrong. And after that, once we got together, put it together, we didn't even find out. When we sat down with the toxicologist that we didn't have them, so we could go to the global, they said, and I said, well, I don't know about it. So I was going to make it. Well, we didn't have. Yeah. No, we're not just so I asked, so what we do? We don't have to. It was money. We got to your meal, went to find him, and got over $2 million for 13 year period, 2 months. And that was from West Fulton, that's what everything else was compared to. Was it West Fulton? It was the person, she said it was the person in the country that was led by me. And how did that change the start? After we did, for the of the STAR program, everybody, does that mean that's where we are? Let's look. No. So, I had one day, and I think a lot of things, what I said, we've been talking about this with the dead, we're dead, we're dying, we're sick, black people are going to fall out. But what we have to do now, how can we correct it? The only way we can correct it, we have to get it out. Yep. The sick of the doctors are the ones that are how important. I talk to my doctor. How much care what allowing to you then you tell me what's wrong with you. And when I finish, she'll say, now I'll tell you what I think you should. But Tommy, I went back to him on so accustomed to dealing with chemicals that I didn't even know. Oh, things that I had said that he had checked. Doctors are not taught this in medical department. No. You got to go to health. You get your PhD in public health. But this is what wrong. We got to get the doctor. That's what is. And so that's actually that is really very a lot of that's all we had sort of day. Yeah. Issue, but as far as getting the doctors, like getting our doctors involved, talking to them about it, what is the end goal of that? Would we be asking them to have it on our behalf with the city? Because really the source of the pollution is a large part of this issue. So our doctors are going to be like, oh, we see this, this, and this. We know that our patients live here, here, and here. We know there's identified facilities here, here, and here. We think there's a correlation. Are they going to come speak on our behalf? No, because we don't need another pill. They're going to be they'll be able to evaluate you better. In other words, instead of saying I got hair black, I make it that I've been for 30 years next to that company.
And so how do we take that to the next level with their help as well?
Is that we will be trying to help them develop communities. It's the remedy.
Part of that agreement
It's usually mentioned in our social. Well, it's not necessarily from the doctors, and I
no, I see what you're saying about the doctors, through the doctor's lens, but when it all boils down to it, we can't just have, we've got to have the doctor saying, listen, we have too many patients with this, this, and this. What are some of the big things? And some of them is adding to the doctor's advocate for us. with the same policy, that would get some better.
Policy, that. We've got to have more policy, not only that, it's that. When the doctors, for example, we have found out on that I love murder in San Diego. How many of them? Said it again, it was a murder. That's how the traditional way, food up and simple side. So if we're doing my problem, then I have problems. Where do you live? How far is that? Now. Did it have anything to do with the Rubbertown? We can always guess what it is. Can we, in their way? No, that's okay. That's fine. No, we're saying it. So I'm saying that perhaps what we're trying to do now is to make doctors so aware, because they're not even aware. To make them aware, to at least start looking at that, and that's what
It's such an important point. I mean, this isn't to just get to the point there. It's like, oh, how to help the problem. Like somebody had a little more information about her, isn't an issue about very much. But if in your medical record, the instance that the clinician says, and it seems to me this person is living with America, it's known that from solely risks, that becomes part of the record, moves lots of places. So one of the great frustrations with that presentation is here's all the cancer. Those cancers have known causes. And I'll tell you what people tend to do is this is the last part of the process of genetics. Nothing people do with the cause. And so the most important thing that we can call is strive to bring environmental data factors, components into those records. Because then the registry will have this is very important to get back on set, but we got to work on the thing. But once you have a lot of people that have been associated with a place and then it's all of a sudden possibilities. And so I think there is some people look through. It's not going to be balanced, but today almost can't face never have. So it's seen that so it's London space of absent now should be property in the history of our species. And so, for a long time, people were hunting. And it's now we're in roughly. So now we're starting to see cause of death. And I think that might be expected of change for the city. But it's not getting people. But the market will come in if you don't, it's just going to be my day, might not. It's not make sense. But whatever it may be, because it's not necessarily thinking about these extra risks that folks take place. I'm supposed to, so I do. I don't next time too, as a smart clinician, but for a clinician, thank you.
Yeah, it's like, for example, I'm trying out with I said that I put the plate on my phone. So I had now for the dollar to talk to me instead of living for me. That's the doctor about what I'm saying to prepare that. You see, keep the farmer a lot more about it. And then 30 minutes. And then 14 minutes. But he agrees, but he that's what it is. We're trying to take about just taking in more consideration of our exposure to thinking a little bit more, trying to get to that nation for them to have a balance on.
Okay, guys, I'm really excited about it, because we have, around this, the nutrient study, I want y'all to follow the community law, okay? In that study, they found out I was deficient in one thing. You know what I have? Less than 200 people in whatever county. Find out if there's one common denominator. One, or two, or three. And all of it is, we need to take more vitamin K. We need to take more vitamin D. We need to get to make it more healthy. Then let's do it. Anything we can do, let's do it. And I'm pretty sure I'm gonna say.
Lauren, but you get to keep that one.
Oh, okay.
All right, so I am the last person between y'all and this meeting and life, so trying to keep us all on time here. My name is Lauren Anderson. I'm a research manager at the Christina Lee Brown Environment Institute, and I'm happy to talk to you today about wastewater research. It's called wastewater-based epidemiology, and from here on out, I'm probably going to call it WB. And so what we'll talk about here today is why we use sewers to track what's going on in people's health. After that, I'll talk a little bit about the science behind it and what we plan to do with this study.
That didn't go the way I thought it would.
All right, I'll back a little bit too. So why we use wastewater-based epidemiology, it has, or just what it is a way to take a pooled sample from a lot of people instead of doing individual testing. So if we can put ourselves back in the days of COVID where we were all driving through those lines getting individually tested, that takes a lot of money and that takes a lot of time. But whenever we can delve down into the sewers and take,
Ready?
Yeah, here we go. So it's a way to get a bulk sample from a lot of different people who are contributing to community wastewater. We have the wastewater system where we can go collect that sample, prepare that in a lab, and then see what's going on with the population's health in general. Can I use this? Yeah. So the benefits is that it has a proven track record. So this method has been used since 1854, whenever a person named John Snow used it to track cholera through the London sewer systems. It's cost-effective community-wide monitoring. So just like we don't have to individually test photos anymore, with one single sample that represents thousands of people. It can provide early warning systems. So we're watching for the flu right now. So a lot of the time, before people realize there's an influx of flu in their community, we can see evidence of that in wastewater. Privacy protection. Again, I'm not looking at individuals trying to figure out what diseases or what's going on with them individually. Instead, I'm looking at a pool of people, 1,000 people. So you can be pretty anonymous in a group of 1,000. And then versatility. So I've already talked about COVID, I've already talked about pollution. We're here today to talk about air pollution. This is a very versatile method for lots of different things. So here's that next screen. It's just fun. If you just look at the red dots, you can see the pattern is all leading to one place where a laundromat was supposed to be baby diapers near the water source, and that was what was contributing to a very bad cholera epidemic in 1854. So the scale, getting back to versatility of wastewater-based epidemiology, we can go from single households to congregate living settings like dorms to neighborhoods. We can go all the way up to regions of the city. And so we're generally right around in this neighborhood, but we are lucky that we have 5 different water quality treatment plants around the world that we can also draw from. So our field methods, similarly, we can choose how we want to take samples. We can take a grab sample. It's just like sticking a cup down in the sewer and seeing what's going on in there. A composite sampler has this little machine. It's basically a fancy pump that draws out a little bit of wastewater every 15 minutes. So we have a 24-hour snapshot of everything that's been flushed down the toilet that day. And then we have treatment plant samples. So this is where all of our wastewater goes to get treated. It's the easiest place to take a sample, really. And so again, there's multiple uses. These are fancy journal titles that talk about lots of different things. So we tried to look for maybe include livestock here. We didn't end up doing that, but we can also use it for pollution and then all kinds of diseases. All right, so we have different analysis methods. So we have genetic analysis for diseases. That's what Aaron's doing up here. And we have chemical analysis for medications and different chemicals. So that's what we'll be doing for this project. And then just like Pat said, we're very excited that we've developed a method to identify chemicals that our body creates, called metabolites, that we breathe in pollution. We expel those through our urine, and that's where it's sort of looking for.
The genetic analysis, is that to differentiate between species, or what is that?
Yeah, so we can do lots of different stuff. So back in COVID, we were seeing what strains of COVID were around. Is it Delta, Gamma, Alpha? We can do that with cells, different types of nasal strains. But I do want you to remember this big tub in this machine, and then also what she's doing here. We'll talk about that a little bit later. All right, and so we just don't study wastewater. Study what people think about what I study about wastewater. And so we have done a public awareness and acceptance survey. So this paper's out for anybody to look at. What these graphs are saying is, are you aware that cities can monitor your sewage for different things? People are a bit less familiar that we can monitor sewage for different diseases than they are that the public health department monitors pools and things like that. So there's relatively equal amounts of awareness in those two things. And then you support wastewater monitoring for different activities. Generally, people say they do support and monitoring for all sorts of stuff, but deadly diseases and environmental toxins are way up at the top about what is the most acceptable thing to monitor in wastewater. So as we monitor wastewater for evidence of this pollution, we feel very secure that people won't be scared of this idea. They might even support it and think about it. All right, I'm going to talk a little bit about wastewater ethics. This is not my background, but instead this work was performed by Kathleen Clark in the Department of Philosophy. She will know it will be in the class of 2026. So research ethics is the consideration of legal and ethical issues surrounding diseases and how our bodies work. And so there are four main principles of research ethics: respect for people, maximizing the good that's coming from the research, minimizing the bad, and making sure that the benefits are equally distributed throughout the society. And so for wastewater research, there are a few concerns raised. So again, people generally support using wastewater-based epidemiology for making purposes, but more education about this process is needed. Community should be involved in what is monitored, where it's monitored, and also have access to those results after. We need to help us create guidelines for managing that and how it's shared to people. Again, data sharing, we need to say something about that, and decision making. So again, whenever we have all these different lines to pull through, talk to state representatives, we need to talk to doctors, we need to talk to local representatives. And so how are all of these groups involved in this decision-making process? So we've got long and hard about how we will make commitments to uphold good ethics for this project, especially around wastewater-based epidemiology. So first, we have respect for persons. So we promise to keep our wastewater research anonymous. That means that we'll only monitor places with at least 1,000 people in it. Again, we would never go to a place to say, you know, this block is really that's too granular and detailed for anyone to want to know. So we want to maximize those benefits. We have a very vibrant discussion about the policies and tools that have come out of this project for the public good. So minimizing harm, we have strong data protection measures. We care about property values, we care about civilization. And so we will never look for the use of illegal drugs, use of alcohol, things like that. An equitable distribution of the results. So these results are intended to benefit the region of West Louisville, but whenever we clean up the air in one place, we clean up the air everywhere. All right, so this section is what we plan to do in this project. So first of all, we will collect wastewater samples, and I didn't see earlier, we will collect one sample a week from 3 different places. And I'll go through those places here in a bit. And so this is whatever it looks like whenever we are collecting those wastewater samples. So here you see one of those composite samplers getting pulled out of the manual.
You said you're.
I do need MSD, so we partnered with MSD, and so I'm so lucky that the person in tag back here will be the one pulling that sample. All right, I don't even know how to open it, so I'm going to keep that place of ignorance in my brain forever. And so it gets removed, it gets opened. Oh, and I meant to bring a prop today. I meant to bring in one of these, but I forgot. But this is what the sample looks like whenever it's pulled out of the ground. So it's a total of 125 millimeters. And then those samples are analyzed. So that 125 milliliters of water first goes through a precipitation process. And so it gets put into a smaller tube, it gets put into this big tub, and then it gets centrifuged around. And so it gets spun down. Once it gets spun down, Erin is the best pipetter at U of L. She will pipette that into an even smaller tube. It's about that big. And then Mr. Poggle will put that into this fancy mass spectrometer. And then the results of what metabolites are in there will out on this computer and will tell us about it. And so we will analyze these samples to find your metabolites of air pollution. And so again, the metabolites are just what your body creates. We're going to refer to any chemicals or anything else. And we can look for evidence of that.
So as far as the breakdown, what it is, we broke it down into what chemicals. And so, are there any chemicals that don't reveal themselves in wastewater?
That is a good question, and I don't know for sure, but I do know that we have done an untargeted analysis of wastewater in several different places. I think we found around 80 chemicals, and so there are more than 80 chemicals in existence in the world, so I'm sure that it is not picking up some, but our main chemicals of concern we were able to identify. And so this is whatever it looks like whenever you populate those results. And so it's hard to tell, but different sites for different colors. And then these were all of the different chemicals that were identified at those different sites. And then we will compare wastewater and monitoring data. And so this is just a map of the air tox screen, and it shows the whole body hazard index from air toxics across Jefferson. All right, and so this map you should remember, so each of these dots is one of the West Louisville monitoring locations. These boundaries are census tract boundaries. They are not sewer monitoring boundaries. But each of these census tracts has over 1,000 people, between 3,000 and 4,000 people in them. And so this is the type of scale that we would be looking at for wastewater monitoring. And then this is the end of my presentation. So I'm happy to take questions. We aim to start in February 2025 and end in February 2026. So exactly 1 year.
Will you all, do wastewater in the area to control some of the urban backgrounds and
Yes.
But if you have about water, but it's not that. But right there.
You want to ask anyone?
Yeah. Oh,
But our bosses are clearly a one percent. Which is that was, but again, so I guess the problem, I have to be sitting, pretty down, I can check with town waste. I'm providing, I have sample records that they can represent. But people don't realize, why they're trying to push out the taxes, because we're so over bombarded, we're getting more taxes in than our bodies.
Let me get detox tea.
Okay, sounds like another week. Okay. Anybody, another question?
Actually, so the epidemiologist had put up, I can't remember your name, I'm sorry. If you still have- Oh, okay. She put up like, she would be slide after slide after chemicals of their health effects were. And just a recommendation, if you haven't already thought about it, is to, once all this study ends, and you're talking about notifying the doctors and all that. Also identifying groups, one of my organization's partners with Falls Medical Society, which is a Black medical group of doc physicians. And it would be great if you all, with that same presentation, where we show the chemicals and their, whatever, the health effects to those doctors. And couple that with the sources of where these chemicals are coming from. That could be a good one too. Their patients are not communicating.
Yeah, that's very good. We've got, Dr. Tucker now. That's what you're saying, so he's going to put the catalyst to get them on law. Okay, so let's do. What is going to put about it, that we need to continue this conversation. It needs to continue. So we're going to have this quarterly meeting and know that not 15 minutes, 20 minutes, we're going to be something that needs to be discussed. So, let's get ready to come with the same, if they come, tell you, we may disagree, that's what we disagree. Well, but anyway, so let me remind you of something. Please fill out those forms that you have if you want to get on the list or to get information. She told me one more, the man up there, she told me one more. The first half of October 19 will be going through this, but there are will be told. Every round because that's where we're going to talk about what we did here, talk about where we need to go. But I'd like to see everybody there to get an opinion. You want to know what you're doing. That would help, like I said, next grade. Are here, take this to everybody. So look, this is our different things and ask people. Yeah. How long was the survey? Long as you tell me. You don't like this. All right. For the next 30 days. Okay, if we need to, we'll keep it up for 3 months. In fact, we might keep it up for all right, and the list. If you ask them, it's what the word you want. So this is the thing about the middle interest, so if you have this, so here about all the parents, maybe you can share with the team. She's what's going on with this problem? Yeah, what's the taxpayer for the, first Saturday in November, 3:30, we will be on WLW. We're going to talk about this. We share with the department and for the chicken, and not going to be able to be okay. Thank you so much. Thank you for talking.